and welcome to Mother Care. My name is Marian and it's always great to have you on the show. Always a privilege bringing it to you. Today on the show we'll be talking about incontinence, and yes, you may never have heard about it, but I can assure you before the end of the show you'll get to know what the 411 is about this. We always give you a mini feature to give you a lot of information, or maybe a little information about the topic. And then when we come back, we've got loads on the show today. Remember, there's always Doctor on Demand where we answer your questions. And of course, we have our doctor in the house who will be talking about the topic of the day. Today on Mother Care, it's a loaded package. Do stay with us.
Urinary incontinence is loss of bladder control. Symptoms can range from mild leaking to uncontrollable wetting. It can happen to anyone, but it becomes more common with advance in age and during pregnancy. Most bladder control problems happen when muscles are too weak or too active. If the muscles that keep your bladder closed are weak, you may have accidents when you sneeze, laugh, or lift a heavy object. This is called stress incontinence. If, on the other hand, bladder muscles become too active, you may feel a strong urge to go to the bathroom when you have little urine in your bladder. This is urge incontinence or overactive bladder. There are other causes of incontinence such as prostate problems and nerve damage. Many people with the condition are afraid to participate in normal daily activities if these activities are too far from a toilet. As such, it is particularly important to note that the great majority of incontinence causes can be treated successfully. Studies have found that pregnancy, mode of delivery, and parity, the number of children a woman has had, are all factors that can increase the risk of incontinence. Women who delivered babies via cesarean section or vaginal delivery have much higher rates of stress incontinence than women who never delivered a baby. Mixed urinary incontinence is a combination of urge and stress incontinence.
Still watching Mother Care. Now, of course, we always go to the streets because we want to know what the real moms think about what we're talking about. And today's topic was actually quite interesting because, believe it or not, some people didn't really know what it was about. And some people knew, but just didn't know the tag. So it was quite an interesting find. Let's see what the real moms on the street are talking about when it comes to incontinence. Welcome back. It's still Mother Care, and I've got Dr. Benga Awoshika in the house, and we'll be talking about incontinence. Now, do you have a question mark in your head just like me? So I am actually going to be educated and schooled today on incontinence. Doc, it's great to have you on Mother Care again.
Thank you.
Now, what is incontinence? When I first, okay, of course, I eventually found out what it meant. But before today, I had to be honest, I'd never actually understood what it meant. But for those who haven't Googled it, like me, what is incontinence?
Incontinence simply means loss of voluntary control of urination.
Is that like bedwetting?
Yes, in children, like
in
bedwetting.
children.
Yes, in children, you say bedwetting when all other causes of incontinence has been ruled out, and the child now loses continence after a certain age, because at certain ages you're supposed to have voluntary control
Of
of urination. A child that is 1 year old may necessarily not be able to, because the bladder capacity is smaller,
small, okay.
and the child is not matured enough to tell you he wants to urinate. But as time goes on, from 18 months to 2 years, the child may be able to tell you, "Mommy, I want to urinate," and the child is expected to stay dry during the day.
Okay.
At night, it may be wet. But by the time the child is 3 years old, the child should be able to have some form of voluntary control even at night.
Even at night, at
Even
3?
at night, yes. Even at,
Really?
at 3, yeah.
At what age should I, as a mom, get worried if my child is not staying dry at night?
Anything from it's said that 15% of children that are 5 years of age still bedwet, and about 7% of those that are 10 years of age
Wow.
still bedwet. So if your child is 10 and 93% of children are not bedwetting, are not bedwetting,
There's an issue.
then there is an issue.
Okay.
So it depends, and you should know that at 5, like I said, 15% of them are not bedwetting. That means 85% of them are not bedwetting at 5.
At 5.
So if your child doesn't fall into the bracket of the 85%, I think you should be a little bit worried. However, there are some causes in children that you may need to consider first. For example, a child might be incontinent if the child have urinary tract infection, because once you have urinary tract infection, you're going to urinate more, urinary frequency. If a child has diabetes mellitus or diabetes insipidus,
Wow.
the child is going to pass urine more, so the child may have continence issues. If a child has other abnormalities that the child was born with, like what they when you have the urethral meatus at the top or at behind the urethra, is not open in front of the penis.
Okay.
Something you called epispadias or
Wow.
epispadias. The child may bedwet.
Okay.
So when you have all these issues ruled out, then you might start thinking of training the child and correcting the urinary incontinence. Actually, in this part of the world, what we normally do actually just creates fear and anxiety in the child, and the child just continues to bedwet. But what is supposed to be done, what is advocated, is what is called positive reinforcement. When the child bedwets, you pretend as if you didn't see the child.
Really?
Yes, you do not complain. But when the child stays dry at night, you have to maybe give him some sweets. You have to compliment the child. You have to give him thumbs up and really encourage him.
Okay, I just had a flash of boarding house. No positive reinforcement there. If you bedwet in boarding house, oh my goodness.
There are a lot of homemade cures and some taboos. Urination in the fire will wake you up at night when you're about to urinate, and some other stuff. I think those things don't work. Positive reinforcement, and there are some drugs, anticholinergics they call them, that they may need to give a child that is bedwetting at night to make him start. And the vagina. That is what is commonly called vesicovaginal fistula, VVF.
Oh, okay.
Yeah, commoner in the north and some parts of the east, around Calabar and all that. Very common, where children with inadequate pelvis get pregnant and they attempt to give birth vaginally. That causes that, so they leak urine throughout, and it has to be operated surgically. That is the definitive cure. Through the vagina or transabdominally, transperitoneal, or through the abdomen. However, in children, I've discussed what needs to be done in children, but in adults, I think you need to see a gynecologist.
Yes, okay.
There are operations, slings that can be done to support the coverage of the urethral sphincter, so that you can just gain control of the urine. Yes, all you have to do is to get to the gynecologist for further management of urethral for urinary incontinence.
Wow.
Yes.
I still keep hearing 40%. That's a large number.
That's a large
and
number.
it's something we never talk about actually.
Women never talk about a lot of
Do you know?
things.
Because I actually didn't know.
At one time or the other in their lifetime, 40%
Amazing.
of women will have continence issues.
Wow. Okay. Thank you so much, Doc. That's why I always love having the doc here, because so many things you don't know, you get informed, and then you know how to treat it. And you know, even if you're in that situation, imagine now that you know 40%. So it's not just you. You are not this abnormal one, and so there's nothing to be ashamed about and just hide where you are. 40%. Thank you so much, Doc. Thank you.
You're welcome.
We're going to take a short break. When we come back, remember we still have Doctor on Demand, so all your questions are going to be answered. Stay with us.
Hello there, my name is Dr. Martina Agbere, welcoming you to your regular program, Mother Care, and of course, our great segment, Doctor on Demand. I hope your week was very lovely and great. Kudos to our mothers who kept date with us last week. The first question here today is, Doctor, please, my baby is 6 months plus, and he has not passed 2 for 3 days. What medicine should I give him? So now let's consider the concerns of the mother. Baby is 6 months plus and hasn't passed 2 for 3 days. I expect that if you did exclusive breastfeeding, it's not a problem. But if you didn't do exclusive breastfeeding, it meant that you have introduced something that this child has taken. So for 3 days not passing 2, is the child constipated? That is what we should now look at. Because for a breastfed child, and there's no change in the number of stools that the child has passed, it is actually not a problem. It is when you have the child hasn't passed 2, which is different from the regular one, then it means that there's a problem here. So the child hasn't passed 2 for 3 days. Is the child constipated? You need to look back. What kind of food are you giving to that child? Are you giving the child enough fluid? How about you, the mother? If you are breastfeeding this child, are you also constipated? Because it is what you take as a breastfeeding mom that the child also gets. If you are constipated, the child will be constipated. So you need to watch your own meal, your diet as a mom. Then you need to also watch what you are giving to the child to take. If you are not giving enough fluid, you need to give fluid. Then of course you can also give very soft fruits like orange juice, oranges. You can actually just give very, very little. But the child is, I can't really say now if that child is constipated because I don't know what you have given to that child. If you are breastfeeding, it's not a problem. But if you are not breastfeeding and you have added other meals, then you need to check yourself. What have you given to that child? Was it more of carbohydrate? Or how about yourself as a mom? Are you constipated? If you are constipated, of course the child will also be constipated. Then the next question is, hello, I have a child who is 3 years now, but his stool is always watery. The first one, the child was like constipated. And now this one says the stool is always watery. From a Hadiza. The child is 3 years old. Well, we can actually actually, this child, when you say the stool is watery, is not a problem. It depends on what you mean by saying this stool is watery. It is only a problem if the child is passing frequent watery stool. If the stool is frequent and is watery, then it calls for concern. But if it's just normal watery stool that the child is passing, it's not something that you should worry about. But if, of course, it also depends on the frequency and the consistency of the stool. That if the stool that the child is passing has probably mucus or blood, irrespective of the frequency of the time, then you need to seek medical attention, seek medical help. So for a child who is 3 years old and the stool is always watery, it's fine, so long as it's not giving the child any problem, there's no blood with it, and there's no mucus associated with it, and of course the child is not crying from discomfort, the child is not dehydrated. So with this, it's still very fine. You don't need to be fidgety or worried about it, so long as all the things I've mentioned are not involved. And with Khadiza's question, we'll call it a day for now. And we hope that you keep sending your text messages as usual. And of course, on our emails, you can send them in. Go to our Facebook page. I can also make your comments and send also your what you want the doctor to answer for you. So have a very wonderful day and stay blessed.
For being a part of Mother Care today. And remember that if you're out there and you have incontinence at any point in time, it's 40% of women, so you're not alone. The major thing is that you should seek the help of a doctor. Get to talk to a doctor. I know it's something that a lot of people will not want to talk about, but hey, your doctor's heard it all, so you go see your doctor. And always remember the figures, 40%. You are not alone. Thank you for all your questions and your comments. Keep them coming in on our Facebook page, tweet at us, and of course you can send your emails. We are always grateful to hear from you. My name is Marian. I will see you next week. Remember, being a mom's the greatest job ever.